What should a food handler do with food after it is thawed in the microwave?
A.
Let the food stand for 2 minutes before cooking.
B.
Cook it using conventional cooking equipment.
C.
Check the temperature in at least 2 places.
D.
Cover the food to prevent it from drying out. The correct answer is B. Cook it using conventional cooking equipment. What strategy can prevent cross-contamination?
A.
Avoid time-temperature abuse.
B.
Prep raw food and ready-to-eat food at the same time.
C.
Prep food on both sides of a cutting board.
D.
Buy food that does not require prepping. The correct answer is D. Buy food that does not require prepping. What does the L stand for in the FDA's alert tool?
A.
Limit.
B.
Look.
C.
Listen.
D.
Leave. The correct answer is B. Look. What should a server do when taking a food order from customers who have concerns about food allergies?
A.
Tell customers with food allergies they will not be able to receive service.
B.
When customers arrive, tell them the food may cause allergic reactions.
C.
Explain the symptoms of an allergic reaction to customers before they order.
D.
Describe each menu item to customers who ask, including any secret ingredients. The correct answer is D. Describe each menu item to customers who ask, including any secret ingredients. What should a server do after clearing a table?
A.
Rinse hands in warm water.
B.
Wash hands.
C.
Apply hand antiseptic.
D.
Put disposable gloves back on. The correct answer is B. Wash hands. What information must be included on the label of a container of ready-to-eat TCS food prepped on-site for retail sale?
A.
Quality of the food.
B.
Reheating instructions.
C.
Potential allergens.
D.
Storage requirements. The correct answer is C. Potential allergens. What causes preschool-age children to be at risk for foodborne illness?
A.
They have not received all of their immunizations.
B.
They only eat ready-to-eat food.
C.
Their immune systems are not strong.
D.
They have hidden allergies. The correct answer is C. Their immune systems are not strong. What must food handlers do when handling ready-to-eat food?
A.
Sanitize their hands.
B.
Wear an apron.
C.
Wear single-use gloves.
D.
Use bare hands. The correct answer is C. Wear single-use gloves.
What is the minimum internal temperature hot food must be held at to prevent pathogens from growing? A. 145 F, 62 C. B. 115 F, 46 C. C. 135 F, 57 C. D. 125 F, 51 C. The correct answer is C. 135 F, 57 C. Ready-to-eat TCS food prepped in-house must be date marked if it is held for more than how many hours? A. 48 hours. B. 24 hours. C. 12 hours. D. 72 hours. The correct answer is B. 24 hours. What should be done with food that has been handled by a food handler who has been restricted or excluded from the operation due to illness? A. Recondition the food. B. Make sure food has not been time temperature abused. C. Heat the food to destroy pathogens. D. Throw it out. The correct answer is D. Throw it out. How many hours can cold food be held without refrigeration before it must be sold, served, or thrown out? A. 6 hours. B. 4 hours. C. 8 hours. D. 12 hours. The correct answer is A. 6 hours. Which symptom, when seen by a food handler, must be reported to your regulatory authority? A. A severe allergic reaction. B. An infected wound or boil. C. Jaundice. D. Diarrhea. The correct answer is C. Jaundice. Jaundice may be the cause of a worker's complexion or eyes appearing yellow. You must notify your regulatory authority about this symptom. They must be kept out of the procedure if the symptom has existed for at least 7 days. A tuna salad is removed from the cooler at 9 a.m. and put out for a buffet at 11 a.m. By what time must the tuna salad be served or thrown out? A. 12 p.m. B. 4 p.m. C. 2 p.m. D. 3 p.m. The correct answer is D. 3 p.m. What practice is useful for preventing norovirus from causing foodborne illness? A. Cooling food rapidly. B. Encouraging staff to get flu shots. C. Cooking food to minimum internal temperature. D. Correct hand washing. The correct answer is D. Correct hand washing. What factors influence the effectiveness of a chemical sanitizer? A. Concentration, protein, acidity, air temperature, strength. B. Concentration, water activity, reactivity, pressure, density. C. Concentration, absorbency, moisture, alkalinity, salinity. D. Concentration, temperature, contact time, pH, and water hardness. The correct answer is D. Concentration, temperature, contact time, pH, and water hardness. What practice can help prevent allergic reactions? A. Providing home delivery service. B. Cooking different food types in the same oil. C. Identifying ingredients for customers. D. Using parchment paper when baking cookies. The correct answer is C. Identifying ingredients for customers. Which of the following qualifies as a physical contaminant? A. Bones in chile. B. Pathogens on unwashed hands. C. Raw chicken juices on a cutting board. D. Mold on cheese. The correct answer is A. Bones in chile. Physical, biological, and chemical pollutants are the three different categories that can get into food. An example of a physical contaminant might be anything like glass, dirt, or food packaging. Or something else that might unintentionally get into the dish. If bones are present in dishes where they are not expected, such as soups, stews, or chile, they can potentially be a physical contamination. What does the FIFO, first in, first out, approach entail? A. Rotating food pans on a buffet line so that the food remain fresh. B. Storing food items so that the oldest is used first. C. Washing hands before and after each task. D. Marking packaged food items with a use-by date. The correct answer is B. Storing food items so that the oldest is used first. It makes sense to use the oldest food first and save the newest foods for later because every food loses some of its safety over time. This not only encourages food safety but also raises the standard of the restaurant's food in general. By avoiding food from being thrown out when it might have been prevented, it also lessens waste. Although the FIFO approach is efficient, other time and temperature regulations should still apply. How should staff make sure the chemical sanitizer being used on a food prep surface is at the correct strength? A. Heat it to the temperature recommended by the manufacturer. B. Rinse it from the surface and then apply it a second time. C. Test the surface first to confirm that there are no pathogens. D. Use a test kit to check the sanitizer's concentration when mixing it. The correct answer is D. Use a test kit to check the sanitizer's concentration when mixing it. What exactly is a thermocouple? A. A backflow prevention device. B. A thermostat in a walk-in cooler. C. A type of impermeable single-use glove. D. A metal-probed thermometer. The correct answer is D. A metal-probed thermometer. Having a metal probe, a thermocouple is a thermometer. The probe's tip contains the sensing region, and a digital reading is provided. This is a typical thermometer that is employed to determine the internal temperature of both thick and thin food. Before taking the ServSafe management exam, you should familiarize yourself with the many types of thermometers. Then, familiarize yourself with the ones your food service company has selected and practice utilizing them. When should a food handler with a sore throat and fever be excluded from the operation? A. Before the regulatory authority is notified. B. After the food handler has a sore throat that has lasted for more than 5 days. C. When the food handler's fever is over 100 F, 38C. D. When the customers served are primarily a high-risk population. The correct answer is D. When the customers served are primarily a high-risk population. What must staff members do when transferring chemicals to a new container? A. Log the transfer in the MSDS. B. Store the chemical in a locked cabinet. C. Complete an MSDS request. D. Label the container. The correct answer is D. Label the container. Which is an example of physical contamination? A. Bones in fish. B. Cooking tomato sauce in a copper pan. C. Sneezing on food. D. Touching dirty food contact surfaces. The correct answer is A. Bones in fish. A food handler's hand or wrist has a cut or a boil on it. What would be the best course of action? A. Be restricted to duties that do not involve food contact. B. Wash hands thoroughly between each task. C. Stay home until the wound or boil is completely healed. D. Wear an impermeable bandage and cover it with a single-use glove. The correct answer is D. Wear an impermeable bandage and cover it with a single-use glove. If a worker takes safety precautions, they can still work with food. An impermeable covering, such as a finger cot or bandage, should be applied to any wounds or boils that are present on the hand or wrist. Impermeable means that no blood or other bodily fluids may seep through it. A finger cot is a cover made of rubber or latex that only fits one finger. There are wrist-specific impermeable bandages available as well. Then, a single-use glove should be placed over the hand, including the fingers. Which of the following is not regarded as a secure method of defrosting frozen meat? A. In a microwave. B. Under hot running water. C. Cooking it with still frozen. D. In a walk-in cooler. The correct answer is B. Under hot running water. It is dangerous to thaw frozen meat in water that is hotter than 70 degrees. This is due to the fact that the meat will get dangerously cold on the outside while remaining frozen on the inside. What symptoms can indicate a customer is having an allergic reaction? A. Appetite loss. B. Wheezing or shortness of breath. C. Coughing blood. D. Left arm pain. The correct answer is B. Wheezing or shortness of breath. What must a food handler with an infected hand wound do to work safely with food? A. Avoid working with raw food until the wound is completely dry. B. Cover the wound with an impermeable cover and wear a single-use glove. C. Place a bandage on the wound. D. Apply hand sanitizer to the wound. The correct answer is B. Cover the wound with an impermeable cover and wear a single-use glove. If food shipments are not received at the proper temperatures, what should you do? A. Bring the food items to the correct temperature within 2 hours. B. File a complaint with your regulatory authority. C. Reject the delivery. D. Accept the delivery, but notify your supervisor. The correct answer is C. Reject the delivery. For food safety, temperature control is essential, and it starts before the food even enters your premises. Your first chance to influence food safety comes when you receive shipments of food. It is impossible for you to know for sure how long food has been kept at an inappropriate temperature if it is not the proper temperature when it is delivered. This is the reason you ought to refuse the delivery. What condition promotes the growth of bacteria? A. Low levels of moisture. B. Food held between 70 F and 125 F, 21 C and 52 C. C. High acidity. D. Food with a pH that is highly alkaline. The correct answer is B. Food held between 70 F and 125 F, 21 C and 52 C. Which of the following signs of a foodborne disease is most typical? A. Diarrhea. B. A rash or hives. C. Congestion. D. Dizziness or vertigo. The correct answer is A. Diarrhea. One of the first things a medical expert takes into account when they hear reports of uncontrollable diarrhea is a foodborne infection. This is due to the fact that foodborne infections of various kinds frequently involve it. What thermometer is best suited to checking a dishwashing machine's final rinse temperature? A. Time temperature indicator. B. Infrared thermometer. C. Immersion probe. D. Maximum registering thermometer. The correct answer is D. Maximum registering thermometer.